All right, well, welcome everybody. We expect a few more people as we get going here. And this is the Safe Passage for Children bi-weekly webinar. And this is the last webinar for 2021. So just watch your in-basket for the next batch that will start somewhere in January of next year. And I hope everybody has a great holiday. So I'm just going to jump right in and introduce our guest speaker, LaCroix-Dalluhn, who is the coordinator, or the, is that, I should read this word for word, but what is your actual title? Yeah.
Coordinators.
Of the Prenatal to 3 Coalition, which represents 40 or 50 local, regional, and statewide nonprofits, coalitions, and networks. And the purpose of the coalition, and you have heard from Laura, by the way, in the past, if you have been with us, because she did a webinar specifically on the Prenatal to 3 Coalition. But their purpose is to raise awareness among policy and decision makers about the importance of the first few years of life, 0 to 3, particularly, and to ensure that the youngest children and their families in the state have the resources they need to meet important developmental benchmarks. And as many of you know, a big part of what Safe Passage is about is trying to reach children and families as early as possible in that first 1,000 days of their life. So the PN3 Coalition Advocacy Group focuses on racial, economic, and geographic inequities, so all Minnesota's children will thrive. The PN3 Coalition is co-chaired by the Children's Defense Fund of Minnesota and West Central Initiative, which is a group in West Central Minnesota that I believe is responsible for distributing some funds to a lot of the agencies out there. So there's a link that I'm going to put in the chat box if you want to find more out about the PN3 Coalition. Laura coordinates the coalition's activities and supports advocacy efforts. And she's going to give us some oversight about the Build Back Better bill and its potential impacts, particularly focusing on infants, toddlers, and young families in Minnesota. So as we've talked about in the past, Laura will give us a nice presentation, then we'll have plenty of time for Q&A. So go ahead, Laura, take it away.
Great. Thank you so much, Rich. I will share my screen briefly. All right. Well, thank you so much for having us here today. I am happy to fill in for my colleague, Deb Fitzpatrick, who is the policy director at Children's Defense Fund. So we work closely together through the Prenatal to 3 Coalition. I am here to share a little bit about the Build Back Better bill and specifically what's in it for the babies, toddlers, and families. But before we dive into the bill itself, I really think it's important to highlight how historic these types of investments are in human capital and in people in this country. We have not made these types of public investments in children and families since the Great Deal. So it's been a really long time. There you'll see there are a number of different provisions in here that have an immediate impact for families when we talk about those. I do want to let you know that what I believe is happening is that a lot of the media attention has been put on the process of getting this bill passed and on the partisanship of it, rather than helping people understand what's in it. So this is a really nice opportunity to talk a little bit more about what's in it. I will also say, because the majority party has a very small majority in the House and in the Senate, rather than going through a normal appropriation process, the way in which Congress is moving this forward is called the reconciliation process, which has become much more normal as we've moved into more partisan politics at the congressional level. But what happens through reconciliation is that you have fewer opportunities to change policy, and so there are several rules around what is germane or what is consistent with what is in some of the other bills. So the process looks different than the appropriations process that Congress usually engages in. So we've heard a lot about the political process. We've heard a lot about the negotiations between the House and the Senate. We often don't hear about those things before a bill passes, but because the margins are so tight, it's really important. And we are bumping into conversations about the debt ceiling. And because everything is so hyper partisan these days, we're seeing conversations about the debt ceiling tied with future spending. And I think it's important to let everybody here know that the debt ceiling conversation is about our past debts, not about this current bill and spending. So it really does include our current spending and past spending. So it is not, while it's consistent and important to have these conversations, it does not have a direct tie to what is going through in this reconciliation process with Build Back Better. So I just really wanted to highlight a few of those things before we go on. So let me start with a little bit about what's in the bill. I'm going to start with some economic factors first. In the bill, you will see that we have paid family medical leave. This is this bill at this point in time has been brought down to 4 weeks and initially started at a 12-week wage replacement. It is now a 4-week wage replacement. This is an opportunity to leave for both a new child, but other medical leave, so you can take care of a family member. There is some progressive wage replacement opportunities here. Many times people will use the FMLA. So many companies will use FMLA policies and even pay some of their employees. But what we see consistently in Minnesota and across the country is that our lowest paid or hourly paid positions, often those workers don't actually have access to FMLA or paid FMLA in the same way that that higher wage earner families do. So this is an important step forward. I know there's been some conversations here in Minnesota. People have asked the question, is it worth it if it's only 4 weeks? We believe it's absolutely worth it. Because it opens the door for having this dialogue long term. We can look at extending this, and 4 weeks of paid leave is far better than no paid leave. And then the other thing I will say is we as advocates have been working to see a minimum of 6 weeks, because if you actually have a child, most child care centers won't even take in an infant before 6 weeks. So we're really trying to at least align some of the other provisions in the Build Back Better bill that we've been working with our national partners to help move that forward. This provision is being paid for through the tax on the highest income earners in the country and some of the corporation closing some loops for corporations, tax loops. And then the payout would begin in 2023. So we're excited to see that this is still in. It had been cut completely at one point in time, but it is currently in the bill that passed the House, that is being negotiated by the Senate. And this is what we have right now. We will also, in the Build Back Better bill, we see an expanded child tax credit. Not sure if everybody here is aware that this provision is in place, but many of you may have received a benefit if you have children of your own. There was in the last bill that passed in March, I believe it was called SURSA is the acronym, where we were helping communities and families build back after the pandemic, although the pandemic has continued and we're in a new wave again. We expanded the child tax credit for families, increased it to $3,600 for kids 5 and under, and up to $3,000 for kids up to 17. This is being expanded all the way through 2021. So we'll see that benefit again come forward for families in the following year. What's nice about this benefit is that it is was provided to families throughout the calendar year. So families who had filed taxes were getting this automatic refund along the way. And then the last 6 months will be sent back to families when they pay their taxes. Families who did not make enough money to be required to file federal taxes are also eligible for this. So if any of you are working with low-income families who weren't required to file, they can still get this expanded tax credit, but they do have to file for it, and then they would be eligible. So it's for your 2020 and 2021 tax years. So it's really important that we help work with our families. And then even if a child does not have a social security number, but they do have an individual tax identification number, then you can still receive this benefit. What we really think this is important is that this is a great strategy for actually reducing poverty. A lot of our tax benefits or social service programs don't actually move families out of poverty. The expanded child tax credit has really made a big difference for some of our lowest income families in this past year. Okay. I'm also excited about several of the Medicaid and CHIP provisions that are part of this bill. So in the Build Back Better bill, you'll see it's requiring states to expand medical coverage, Medicaid coverage, excuse me, postpartum, 12 months, and it ties their match to that requirement. Minnesota actually passed this expansion in the 2021 legislative session, and I have a slide, we'll go through that next, but this requires all states to be in that position. It also provides resources to grow and diversify the perinatal workforce. Right now we see large disparities in we see fewer BIPOC providers in Minnesota and across the country. So this is some investments to help diversify the workforce, and then also provides resources for investments in education and anti-bias training for perinatal health. The reason for that is we have seen really persistent disparities in maternal and infant health outcomes for our Black American-born African-American families and Indigenous families, regardless of income, regardless of where they live in the country. And there's evidence that it is unconscious bias, implicit bias, and straight out racism that is impacting these birth outcomes. So there's an important investments to be made to help move us in the right direction for families. The other piece about Medicaid and CHIP is the Children's Health Insurance Plan is now a 12-month continuous coverage for children as part of this bill, and it makes the funding permanent. Currently, Congress has to renew it. So many times we have a budget that gets renewed. If it's permanent funding and Congress goes through the reconciliation process or Congress goes through the appropriations process, then those permanently funded programs automatically get renewed or up, you can keep funding flat or increase, decrease. But the current way the law is written is Congress actually has to reapprove the policy in and of itself. We saw a gap in service in 2017. So we're really excited to see this continuous coverage. And then the other really promising piece in this legislation, in Build Back Better legislation, is to allow states to increase the upper eligibility income or upper income eligibility for families. This would allow us to have a broader range of families who become eligible. And if a state wants to make those public investments, they would now have that option, which is not currently the case. I said I would tell you a little bit about the Minnesota extended benefit. So The Build Back Better requires states to extend the MA postpartum benefit. Currently, it's at 60 days in federal statute. We have some allowable language that during the public health emergency, where you haven't been able to cut people off of their Medicaid during the pandemic, but this will change it from 60 days postpartum coverage to 12 months. In Minnesota, our legislation will start July 1 of 2022. We're really excited about seeing this in Minnesota, and think the federal legislation just helps strengthen the support for this. But we know that 24% of pregnancy-related deaths occur in that 45 days up to the full 12 months postpartum, versus only the 19% that were in the first 45 days after postpartum or after birth. So this is a really nice way to help capture medical issues for the birth giver, and helps decrease concerns around access to mental health services for postpartum depression. And then the other benefit is that we see lower uptake or lower access of child visits when the parental access to healthcare is stopped. So we see in states where they have this extension, we'll see better outcomes, hopefully in Minnesota as well, in families getting the care for both the birth giver, caregiver, and the child. Okay, I'm going to shift a little bit out of the healthcare area into childcare. This is one of the most robust areas of the bill that has been maintained. So as the House and Senate are negotiating, they have very little room for people to not vote for this because their majorities are so tight. But the child care piece of this has been consistently strong in all negotiations. And I am very excited to tell you, we have in the Build Back Better bill, $450 billion in new early childhood funding. There's going to be two different pots of, two different funding sources. There is the child care program for building off of for children and youth, but it builds off of the current federal funding, the Child Care Development Block Grant. It becomes a universal program for families, universal child care for 0 to 5. And then the funding stream, the federal funding stream that we use now for subsidized childcare will eventually flip into a school age care program. But this does put $225 billion into childcare. So that would be center care, that would be family child care. So it doesn't limit where families are getting it. But this is a great opportunity for families. We'll talk a little bit more about the details. And then we have $200 billion for the universal preschool. And the universal preschool is a mixed delivery. It is a system. We've been working hard in Minnesota to try to help replicate as much as possible what we have in our early learning scholarships program. So we're looking at this, trying to figure out how do we help make that as consistent as possible for families. But the universal preschool means that all 3 and 4-year-olds would have access to preschool in Minnesota. And then we would have, there's funding for the child care infrastructure. So we have child care deserts across the state of Minnesota, and there are a number of family child care providers that need some additional support in the infrastructure of their own homes. So there are resources available to help with infrastructure as well. So let me tell you a little bit about what this means in the child care for American families. The language says that children who are eligible in households, children are eligible if they live in households earning 1.5 times the median income in their state. So what does that mean for us in Minnesota? The median income in Minnesota is $108,713. dollars. So that's the median income. So anyone within 1.5 times that income is eligible for this free childcare. So it essentially becomes an entitlement program. A couple examples that my colleagues and I have helped kind of create is that a single father with a 4-year-old who earns $75,000 a year could expect to pay $750 to $1,500 for childcare the entire year. Similarly, a family of 4 who earns about just under $119,000 a year will pay anywhere from between like $100 or $1 and $200 a month. So we are looking at significant support to families who make a good income for themselves, and this will really help families immediately upon arrival. The goal has been consistent. We don't want families to pay more than 7% of their income for childcare. And our lowest income families will receive free childcare. The funding that is available has rules and regulations around inclusive childcare for children with disabilities. We also are looking at trying to address some of the concerns we have in childcare in Minnesota, that the business model doesn't work. Right now, families can't afford to pay, but the people who are providing the services live in poverty themselves. They're making poverty wages. You could make more going to work at a Quick Trip or a McDonald's than you can working in childcare. And so it's really been difficult to get people in this business. We want trained, highly skilled people to do this work. So there are funds available as well to help address wages. And then there are quality requirements in there. We're using the Head Start requirements kind of as a guide for all of our childcare providers across the country. Many families choose to use a family, a friend, or a neighbor to provide care for their child. Sometimes because it is a choice based on lack of other choices or fewer programs that are available overnight for third shift or weekend care. So we do have some provisions in Minnesota, as well as the federal funding, that Child Care Development Block Grant that I talked about before. There are still resources in that federal fund to help support family, friend, and neighbor care. So there is a process that families can go through to receive subsidy for helping provide care for children. Okay, one of the last things I think I will wrap up with, and then we can turn to questions, is the process that it takes. So once, so the House has passed this bill, the Congress has passed this bill. It is now sent over to the Senate. The Senate needs all senators to sign on to pass this, and we need our Vice President to sign this for it to pass. It will then likely go back to the House because we expect that there will be some changes from the Senate. The House will then work to adopt those changes. It will go to the president to sign. It is expected that we will see this pass. It's just a lot of negotiations that need to take place. Once it passes, I'm going to say once, might not be till the end of this month, but it might be in early January. Each state needs to decide if they're going to opt in. And the governors will decide which state agency is the lead. I'm thinking about the child care provision specifically, that each state governor will make that decision. So currently in Minnesota, our Human Services Department leads the child care licensing and subsidy payments. So they may be the lead, but we also have our early learning scholarship program that is run through the Department of Education. So that's another option. And then the third option, which I did not put because it's not there yet, but there are conversations about creating a new agency that is focused solely on early learning programs. So the programs before age 5. So that could be something that we consider in the future. It is expected that the governor will opt in Minnesota, but if we have a state where they don't opt in, local units of government can opt into some of these provisions. And this is specific to the childcare because we just have such a great need for childcare in this country, and the business model, because it's not been very efficient for families, is something that we've all been working on across the country to make sure we get past. The other thing that I want to note here before we take questions is that in Minnesota, our legislature will need to approve the use of these funds. So we do not allow state agencies in the state of Minnesota to move forward with administrative rule in using federal funds. The legislature does have to approve this. I will say there have been some legislators, I'm hearing this secondhand, thirdhand, I have not heard it directly to my face, but I am hearing that there are some concerns by our Republican leaders about this. So we are going to need to do some work in Minnesota to make sure that childcare is accessible to everybody. There have been some statements around the role of a woman is to be at home with her children, or to not have schools be in the role of childcare, that individual businesses should start childcare. So the good news is that people are aware that there's going to be an impact in childcare, and there are opportunities to really make some long-term decisions about where we want to go and how we want to support children and families in the state of Minnesota. So that is the promising piece. We do have a task force called the Great Start Task Force that started meeting last night. They had their first meeting, and they are charged with looking at the business model of childcare in Minnesota. So the timing of this legislation, or this federal legislation, is really good for us in the state of Minnesota, because we will have the opportunity to dive deep into some of these conversations. The other concerns that I've heard, and then I'll stop sharing my screen, is around the timing of this and the cost of this to states. So there is a 10% match after the first 3 years in the childcare portion of this bill for states. They are trying to be, the federal government is trying to be as flexible as possible. So thinking about our early learning scholarships as a potential match for this is one way. We do have a number of other tax credits. We have our kindergarten readiness program. So there's a few other programs that we could use as matching. And then we do put some state funds into our subsidy program. So all of that would add up to the matching portion of it. And then the other concerns that I have heard people state is that this is not a long-term program. In order to have it completely paid for, Congress had to put, I think it was it was 2025 or 2027. So we have a 3 to 5 year window and where these funds are made available, because they wanted it to be completely paid for. And what I will tell you is I am far less concerned about that, similar to when I started talking about the paid family leave being at 4 weeks. This is the way legislation is made. This is the way funding decisions are made in Minnesota and across this country. And it's important to know that we have the ability to go back and renew things and or change things. And so I'm far less concerned about that than maybe some other people are, but this is a normal way in which we do move forward. So with that, I will stop and take questions.
Thank you, Laura. That was really, really helpful. It's been hard to really understand what's going on in this. And so I'll open the floor to questions. I have some, but if somebody wants to go first, I'm happy to hold back for a while. Just you can see Greg there. Greg is a member of our board and a retired child protection supervisor for many, many years in Hennepin County. So he's intimidatingly knowledgeable.
Well, I'm not sure about that, but anyway, I wasn't sure I was following the income part of that medium income, the 1.5.
Yes.
If you're saying the medium income is like $104,000, 1.5 puts it at about $160,000. Is that like the top income bracket? So is it like 1.5 or up to 1.5 of the medium income?
It's up to 1.5 of our medium income. And then it will go a little bit beyond that, but the subsidy decreases significantly. So it's really the goal of this program was to try to hit as many of our middle income families as possible with this 7%. So that's how they landed on the 1.5. And I just gave you the Minnesota medium income it's 100 and just shy of 109,000.
Okay. And is that per parent, per family, individual income?
I believe it's a per household.
Regardless of the number of parents.
Right.
Okay.
And that's I don't know if you're anyway. Just making me think out loud here. I will have to look into how they manage care for children that live in multiple homes. I don't know actually off the top of my head. I would have to look in. I don't know if that's where you were going, but I do know that children live in multiple homes, and so it'll be important to figure that out. I'm assuming we'll use the same process we do now with the child care subsidy, but it's not always safe to assume.
Yeah, well, I was just trying to understand because I know my experience has been is that there's usually these formulas that get kind of complicated at times. So I just trying to understand the basics of the formula. Because especially if you talk about at some point it's like a 0% payment, it sounds like it's a tiered income eligibility levels, like a ladder.
Yes. So the goal is to make it free for our lowest income families.
Yeah.
And then they tier it up.
Okay. Thank you.
Yeah.
Well, I just want to, please, anybody else wants to ask questions, just jump in, and I'll save mine for later. But it's so important in terms of child abuse and neglect, which of course is our area. And Laura and I have talked about this over the years quite a bit, but basically there's I've just been reviewing the research on this, and the impact of income on child maltreatment is so much bigger than things like, screening in more children of color, or bias among caseworkers. I mean, it just is overwhelmingly more important. And so, for example, even a little bit more earned income tax credit uptake in the state. You have states where it's not easier to get or where people don't know about it. But if you can just increase the use of earned income tax credit, that has a noticeable effect on child maltreatment. So I just call it the child care allowance, but I guess it's the proper term is the child care credit, right? Is that right?
Yeah, the child tax credit is different than if you were like the tax credit for childcare, if that makes sense. So
I'm talking about what I just call a child care allowance, like they have in Europe. Just because you have a child, you get X dollars in subsidy, and I think that Biden's been talking about that, having a huge impact in terms of reducing the number of children in poverty, like 50% or some huge number. You may know the number, but I just think that those two things alone will have a big impact. And it's not, it's hard to talk about it because people think what you're saying is people are their children, and that's not true. Most poor families across all demographic groups, races, and so forth, raise their kids just fine, despite the struggles of being poor. But it is true that concentrated poverty drives higher maltreatment, which is kind of understandable because, you know, if you've ever lived in poverty, it grinds you down. It just grinds you down. So, you know, we have to be careful that people don't get the wrong message from that. But the point is that if people have more income, then that translates into less child maltreatment. So we spend so much time on kind of marginal areas of where we can improve disparities, racial disparities in the system. The big impact is from income. That's where you get the powerful impact. So I'm just really hoping this goes through and that the childcare, the childcare kind of bonus or package that all children get, all families, gets to be permanent and bigger, because I think that'll really make a difference.
Well, I can give you my own personal opinion because
Yeah.
I wholeheartedly agree. I think the child tax credit is one of that, and I personally believe that the child tax credit, the paid family leave, and the child care pieces together will help solve all kinds. I mean, will really help benefit families and give kids the best start, help stabilize families. So I just those three things together, that trifecta is just huge.
And I think that that infants are eligible is really, really important, because that first 1,000 days, people think that neglect is not as important as abuse, but 72.9% of child fatalities last year were from neglect, primarily neglect cases, not primarily abuse cases. So it is deadly, and the consequences of developmental, deprivation early on are lifelong and often much more serious than abuse. So those are messages just hard to get through in a public policy forum, but we won't have as much need to get those messages across if all of these pieces go, especially the infants. And I don't know if you've been tracking, but there's been a rash of infant deaths in the last 3 months of 2-month-old, 3-month-old, 6-month-old children. And if some of those kids have some eyes on in childcare, then 50% of children who are killed from child abuse and neglect are less than 1 year old. So if we can get some of those kids, a lot of them in child, all of those things will make an enormous difference.
Yep, I agree. And I think one of the politically, the child tax credit, if we can get it through the Build Back Better bill, there's been conversation about scaling it down, because right now it actually it is accessible to the top level of the income is pretty high. So I think there was a lot of debate and conversation about should we lower it down? But the first thing is we have to expand it first. Continue to keep these increased numbers and see the impact and learn from what we have.
Do you know what the top income bracket is to get the child tax credit? I
do not have it off the top of my head, but I can try to get that.
It's all right. Just curious. Good. So we're certainly hoping this goes through. Any other questions, Greg? Our other guests, Casey and Ashley? Stephanie, you've got 3 young kids.
Yeah, no, I do have a question. I was just gonna let anybody else ask a question if they had one. But going off of what I've just heard both of you talking about, if we're talking about especially that stress that is on families, and I would wager just my own experiences, mothers especially, that first year of life with a baby, thinking about these issues with increasing, paid maternity and paternity leave in the U.S. Over the last 6 years now. I became a mom 6 years ago. So all of a sudden, that issue, paid maternity leave was front and center in my mind, right, when I had my first baby. And, I've been incredibly blessed with, being able to have some of that paid leave myself, but I've also learned a lot about the issue, not just statewide, but also nationally, just being able to study that myself, and just how staggering, the differences are in how, maternity and paternity paid leave is offered in the US versus compared to other countries. And so when I heard you talk about that, Laura, that was really exciting for me to hear that this 4 weeks has been approved, and now that's been in discussion, because I think that is a great starting point for that, and we can only build from there. I mean, because when I look at the experiences of friends that I have that live internationally who have become parents, and, you know, like in Norway, for example, or in Hungary, or even if you look at, like, you know, friends have told me about, you know, like families that they know who live in Greece, you know, and they've got, what, 30 or 40 paid weeks of maternity leave. And I know I'm preaching to the choir here, but I mean, it's just amazing the difference, right?
And
That
Greece
the
is
US
broke
offers
too.
parents versus in other countries, you know, and I think it's something that a lot of people are not really aware of, how vastly different parents are treated when they have a baby in the US versus parents in many other countries, you know. So again, I'm preaching to the choir here, but you know, this was an issue that became front and center to me when I became a parent, and now is very near and dear to my heart. It's like, well, how do we keep growing that 4 weeks? How do we make that into 3 months or 6 months or even a year for parents in the US? I would like to see that in my lifetime. But that's just me. I just know how important it is for babies to have that time with their parents, you know, and for being able to establish, you know, breastfeeding, you know, with their mother. And, you know, just, you can't do that when mom's trying to go back to work, you know, super soon and stressed because they're not making ends meet. You know, they just can't relax and do those important things, you know, that are so important in the first year of a baby's life. So anyway, that's my soapbox.
And you know, just remind, we always say we can't afford it in this country, and Greece is broke, and they've been broke for years, you know, and they still managed to pull it
Yeah.
off. I just,
Yep.
one
Yeah,
question
exactly.
for you. Laura, do you have any idea what it's going to take to get Joe Manchin and Kristen Sinema over the top? What is it going to take? Are they close?
So I think, well, I will say, if you absolutely can reach out to any senator, U.S. senator, even if they're not your own. So it's okay for everybody here in Minnesota to reach out to those two as well. And I do know that I've been working with some of my colleagues in West Virginia on for Joe Manchin, and the concerns around the cost of paid family medical leave. That was one of his concerns. I don't know if it will be in the final bill. I sure hope. So it would help to reach out to your family and friends who are in West Virginia. Do some contacts with them yourself if you want that. One of the things that I will say about that, also that provision as well, is one of the benefits that we often don't talk about is paternity leave would be part of that, so that fathers can take time and have paid time to be with a newborn and or a family member to do the caregiving. And we don't always highlight that when we are talking about paid family medical leave. But we have done some, the city of Minneapolis, their public health department did some research a few years ago to show the positive on the impact fathers have in the lives of their child, whether they're the primary parent or not, regardless of the relationship with the other caregiver, the mother or other caregiver in that family. Everybody's health is better when a parent or when a child has access to both parents, and so the health and wellness of all increase. So that's another added benefit that I think is something that we don't always discuss. And then the medical leave piece is huge, right? So if you have, it just helps take away some of the stress if you need to do caregiving for somebody else. And then the trade-offs for the two senators is, I think it's really going to be, what's going to add the pressure. I think the pressure of not doing something significant is going to be greater. However, the new variant coming in is making people nervous, and does that respond to the needs? So it might not happen quickly, but I think if it doesn't happen before the next election, I think we're going to see a huge shift in who's in office and who's not in office. So I do think eventually they will move forward on something. And I'm hoping that some of these provisions that I've identified today will remain in the bill.
And you mean who's in and out of office, meaning the Republicans will get the majority in both House and Senate? Is that what you mean? Or
I think if this bill does not pass, I think that's even more likely. Mm-hmm.
Yeah.
Mm-hmm.
So, okay. All right. Well, thank you, everybody. And thank you, Laura. That was really, really helpful. We'll have this up on our website. So if you want to, review for the test and, get all the information down, I'm going to look at it again. So I can make sure I've got it in my brain. And so I hope everybody has a nice holiday season. And thanks again, Laura, for pinch hitting. You did a great job.
Thank you for having us.
Bye-bye.